Hello and good evening. India and the world are still battling the coronavirus pandemic with their backs against the wall. Prime Minister Narendra Modi addressed the nation on Tuesday morning and announced that the lockdown will remain in place till the 3rd of May. It will be implemented and monitored even more stringently now. Each locality in each district will be under the scanner, and if it follows the lockdown perfectly and does not become or remain a hotspot till the 20th of April, then some relaxations in that particular area could be considered. Extensive guidelines are expected on Wednesday, and we'll be talking about this latest COVID-19 combat measure on Newsnight with our guests tonight as well. I'm Gautam Roy. Let's begin with our headlines. Prime Minister Narendra Modi announces the extension of nationwide lockdown to the 3rd of May in his address to the nation. Those areas which remain out of the hotspot list till the 20th of April and are not potential hotspots may be considered for some relaxation. Calls are to the nation to lend a hand in following 7 steps, which include taking care of the elderly and maintaining social distancing. The PM says lockdown 2.0 will be implemented even more strictly. New guidelines are to be issued on Wednesday. The PM described the situation in India as far more under control compared to the rest of the world. Says if India had not acted on time, the situation would have been much worse. The PM pays special attention to the concerns of the poor during lockdown. Says it's his government's top priority to reduce the difficulties of those who take care of their needs, earning daily wages. Several political parties, WHO and corporate world welcome the lockdown extension. Total cases of coronavirus in India climbs to 10,815. 353 fatalities so far. 1,189 patients discharged after recovery. Health Ministry says 602 dedicated COVID-19 hospitals ready countrywide with 12,024 ICU and 106,719 isolation beds. Police dispersed migrants who had congregated at Bandra station in Mumbai after lockdown extension announcement. Situation is now under control. Home Minister Amit Shah speaks to Maharashtra Chief Minister Uddhav Thackeray, says administration needs to stay vigilant to avoid such incidents, assures all help from the centre. Indian Railways keeps all passenger train services in suspension after the lockdown extension. Aviation Ministry also extends the suspension of all airlines' operations till the 3rd of next month. Worldwide battle against coronavirus remains ongoing. Around 19,35,000 people infected so far. Over 1.2 lakh lose their lives. Death toll in Spain climbs to 18,000. Iran says for the first time during this month, the number of those succumbing to COVID-19 remains under 100. And the nation remembers one of the founding fathers of its constitution on his 129th birth anniversary. President, Vice President and Prime Minister pay heartfelt homage to Dr. Ambedkar. Well, Prime Minister Narendra Modi announced the extension of the nationwide lockdown in the country, which has been on from the 25th of last month till the 3rd of May in his address to the nation on Tuesday morning. The PM said this is the only way to ensure that the coronavirus pandemic is beaten back. The gains of 3 weeks of lockdown cannot be undone with the reopening at this stage. He said the coming 1 week is even more crucial, specifically the 20th of April, because that will determine whether any particular area can be given some relaxation or not, depending on the situation there. Here's more.
भारत में लॉकडाउन को अब 3 मई तक और बढ़ाना पड़ेगा। स्थानीय स्तर पर अब एक भी मरीज बढ़ता है तो ये हमारे लिए चिंता का विषय होना चाहिए। जो रोज कमाते हैं, मेरी सर्वोच्च प्राथमिकताओं में इनके जीवन में आई मुश्किल को कम करना है।
Prime Minister Narendra Modi taking the tough decision in the fight against coronavirus. He extended the lockdown. It will be stricter for the coming days till the 20th of April. That's when a thorough review of the situation at all levels will be undertaken. After that, conditional relaxations in areas which are outside of COVID-19 hotspots may be implemented.
20 अप्रैल तक लॉकडाउन का कितना पालन हो रहा है, उस क्षेत्र ने कोरोना से खुद को कितना बचाया है, इसका मूल्यांकन लगातार किया जाएगा। जो क्षेत्र इस अग्नि परीक्षा में सफल होंगे, वहां पर 20 अप्रैल से कुछ जरूरी गतिविधियों की अनुमति छूटछाट दी जा सकती है। लेकिन याद रखिए, ये अनुमति सशर्त होगी। लॉकडाउन के नियम अगर टूटते हैं तो सारी अनुमति तुरंत वापस ले ली जाएगी।
To mitigate the impact of the lockdown on the poor and underprivileged, PM Modi assured that their welfare is a top priority. They would be kept in mind while drawing up fresh guidelines related to coronavirus on the 15th of April.
20 अप्रैल से चिन्हित क्षेत्रों में इस सीमित छूट का प्रावधान हमारे गरीब भाई बहनों की आजीविका को ध्यान में रखते हुए किया गया है। अब नई गाइडलाइंस बनाते समय भी उनके हितों का पूरा ध्यान रखा गया है। इस समय रबी फसल की कटाई का काम भी जारी है। केंद्र सरकार और राज्य सरकारें मिलकर प्रयास कर रही हैं कि किसानों को कम से कम दिक्कत हो।
PM also highlighted that the country has enough stock of medicines and ration, and hurdles in the supply chain are constantly being addressed. He also said that the country's health infrastructure is robust and being expanded. In January, there was just one lab for testing coronavirus. Today, there are over 220 such labs. The global experience shows that for every 10,000 patients, around 1,500 to 1,600 beds are needed. In India, currently, there are arrangements for over 1 lakh beds. Not just this, over 600 dedicated COVID hospitals have been set up, and these facilities are being expanded rapidly. PM Modi also urged young scientists to work for global and human welfare and take up the challenge of developing a vaccine for coronavirus. Bureau Report, DD India.
Now, Prime Minister Modi's announcement of extending the lockdown to the 3rd of May was widely welcomed by different sections of society, be it several political outfits, chambers of commerce, corporate leaders or the medical fraternity.
The Union government is taking all steps to curb the spread of coronavirus. Prime Minister Narendra Modi has announced the extension of the nationwide lockdown till the 3rd of May. His announcement was widely welcomed by union ministers, political parties, state chief ministers and the corporate world. Union Home Minister Amit Shah in a tweet said, "Today, even as the world is battling the coronavirus pandemic, India, under the leadership of Prime Minister Narendra Modi, is leading by example. Timely measures taken by the government and people's participation has been exemplary." The Home Minister also appreciated the efforts of state governments and appealed to people to abide by the rules of lockdown. He moreover assured that there would be no shortage of necessary items. "I, as the Home Minister of the country, reassure one and all that we have sufficient stocks of medicines and essential goods. I also urge those who can afford to come forward and help those in need," he tweeted. Defence Minister Rajnath Singh also appealed to people to abide by the government's lockdown measures, as the Prime Minister's decision was aimed at ensuring the health and safety of all. In a tweet, he said, "I am sure the collective willpower of the nation will succeed in defeating coronavirus." In this time of crisis, the nation must stay safe, remain alert, and cooperate with authorities. We must stand united. This is our greatest strength. Union Minister Ravi Shankar Prasad also tweeted an appeal to ensure success of the lockdown till May 3rd. In his tweet, he said, "Motivational message to the country by Prime Minister Narendra Modi. He has shown exemplary leadership and Team India is committed and dedicated in the fight against COVID-19. Let's rededicate ourselves to make the lockdown till 3rd May a great success and show our national resolve." Union Minister Prakash Javadekar has also welcomed the decision.
मुझे लगता है कि देश सुनेगा, 130 करोड़ जनता पूरी ताकत से इस लॉकडाउन में शरीक होगी। मुझे पूरा विश्वास है कि देश की जनता पूरा सहयोग देगी।
Almost all states have welcomed the decision as being absolutely necessary.
Lockdown will be followed more strictly till April 20, as Prime Minister said, and the situation will be closely monitored.
सारा देश और मध्य प्रदेश भी उन्होंने जो रास्ता दिखाया है, दिशा दिखाई है कोरोना को परास्त करने के लिए, उसी रास्ते पर चलेगा। उनके आह्वान का हम अक्षरशः पालन करेंगे।
उत्तर प्रदेश की 23 करोड़ जनता और उत्तर प्रदेश की सरकार माननीय प्रधानमंत्री जी के मार्गदर्शन के अनुसार लगातार कोरोना संक्रमण के संकट से लड़ रही है, सफलतापूर्वक लड़ रही है और आगे भी जो माननीय प्रधानमंत्री जी का मार्गदर्शन है।
प्रधानमंत्री ने जिस तरीके से देश में लॉकडाउन की अवधि 3 तारीख तक बढ़ाने का काम किया है, हर नागरिक इसको समझता भी है। मगर आज कम्युनिटी ट्रांसमिशन को हम एक हद तक तो रोक पाए, मगर उसको बिल्कुल समाप्त करने के लिए एक एक नागरिक को इसको समझना पड़ेगा।
The corporate sector too has hailed Prime Minister Narendra Modi's decision to extend the lockdown.
He has broken this whole fight against COVID into 15-day cycles. The experience from other countries is that it can reoccur if you open up too slowly. The second important thing was that he has talked about the gradual, calibrated opening up post 20th April.
The experts were, forecasting that the lockdown would be extended at least through the end of April. I think this is certainly the right move to extend by up until May 3rd and then have some sort of graded relaxation. I think it's a very sort of sensible approach based on looking at where the hotspots are in respective states and cities.
आज जो हमारे प्राइम मिनिस्टर ने लॉकडाउन एक्सटेंशन अनाउंस किया है, मैं इसका पूरा समर्थन करता हूँ। ये बहुत ज़रूरी है कि इंडिया में कोरोना के केसेस को हम सब मिलके जीरो बनाएं।
PM Modi's announcements need to be followed in letter and spirit by one and all. This includes not just ensuring the success of the lockdown, but also supporting the Prime Minister on the 7 points he has stressed upon. Bureau Report, DD News.
Well, the lockdown has brought hardships for one and all, but its impact has been felt the most by the country's poorest sections. The Modi government has been conscious of this humanitarian aspect of handling the coronavirus pandemic and has rolled out several schemes and benefits to help a wide section of people, particularly those who are financially poorly off. A 1.7 lakh crore worth package was announced soon after lockdown and more has followed. Take a look.
जो रोज कमाते हैं, रोज की कमाई से अपनी जरूरतें पूरी करते हैं, वही मेरा एक बृहद परिवार है। प्रधानमंत्री गरीब कल्याण योजना के माध्यम से सरकार ने उनकी मदद करने का हर संभव प्रयास किया है।
Providing relief to the poorest sections of society during the lockdown period has been among Prime Minister Narendra Modi's top priorities. Ever since the lockdown was initiated, the government has taken several steps to help those in need. A helping hand has been lent through the Pradhan Mantri Garib Kalyan package, the Pradhan Mantri Garib Kalyan Yojana, the Ujjwala LPG cylinder scheme, PM Kisan Yojana and direct cash transfers into Jan Dhan accounts since the 25th of March lockdown began. Finance Minister Nirmala Sitharaman announced the 1.7 lakh crore worth Pradhan Mantri Garib Kalyan package on the 26th of March this year. The government announced free food grain and cash transfers to women, elderly and farmers as a part of this package. Till the 13th of April this year, Cash assistance of 29,352 crore rupees has already been disbursed to 32.32 crore beneficiaries through DBT.
गरीब कल्याण पैकेज के द्वारा लॉकडाउन में हमें भारत सरकार की ओर से जो मिलने वाला राशन सही तरीके से मिल रहा है.
Under the Pradhan Mantri Garib Kalyan Anna Yojana, of the 40 lakh metric tons of food grain earmarked for 31 states and union territories, 20.11 lakh metric tons of food grains has already been lifted. 5.29 crore beneficiaries have already received 2.65 lakh metric tons of free ration. 3,985 metric tons of pulses have also been disbursed to states and union territories.
प्रधानमंत्री ग्रामीण कल्याण पैकेज के द्वारा जो राशन लाभार्थियों को दिया गया उनमें से करीब 50 लाभार्थियों को इसका लाभ मिल चुका है.
97.8 lakh free LPG cylinders have been distributed so far to beneficiaries under the Pradhan Mantri Ujjwala Yojana. 1.39 crore cylinders have also been booked under the scheme.
प्रधानमंत्री गरीब कल्याण योजना के तहत जो 3 सिलेंडर देना था उसमें से पहला सिलेंडर मेरे खाते में आ चुकी है और मैं प्रधानमंत्री की बहुत बहुत धन्यवाद देती हूँ.
सरकार ने मुझे गैस के पैसे भेजे हैं और मैंने उन पैसों से गैस भरवाई है. मैं मोदी सरकार का बहुत बहुत धन्यवाद करती हूँ.
This financial year's first installment under the PM Kisan scheme totaling to 14,946 crore rupees has been transferred into the accounts of 7.47 crore farmers.
मेरा कृषि कार्ड बना है जिसमें कि 2-2 हजार हमारे को मोदी सरकार जी ने जो डाला मुझे मिला है. मैं उसका अपने कारोबार के लिए यूज कर रही हूँ. मैं भारत सरकार का बहुत बहुत धन्यवाद करना चाहती हूँ कि आपने हमें ये जो पैसे दिए हैं हम उसका अच्छे से कारोबार में यूज करेंगे.
The Modi government brought the unbanked poor into the nation's financial mainstream through the Jan Dhan accounts, and now financial assistance is being given to them using these accounts. 19.85 crore women Jan Dhan account holders have so far been given 9,930 crore rupees. 2.82 crore elderly, widowed and Divyang beneficiaries have been transferred 1,400 crore rupees. 2.17 crore building and construction workers have been given financial assistance.
कोरोना महामारी के चलते हुए भारत सरकार द्वारा जन धन योजना खाते में मेरी बेटी के 500 रुपए की राशि सेंट्रल गवर्नमेंट की तरफ से और मोदी जी की तरफ से राहत के तौर पर दी गई है. इसके लिए हम उनके बहुत आभारी हैं.
2.1 lakh EPFO members have so far taken benefit of the online withdrawal of non-refundable advance from EPFO account amounting to 510 crore rupees. Non-refundable advance of 75% of outstanding balance of 3 months' wages, whichever is lower, is allowed to members. Payment of 24% of wages as contribution to EPFO members drawing wages below 15,000 rupees per month in establishments up to 100 workers. An amount of 1,000 crore rupees has already been released to EPFO for the scheme for the month of April 2020. The increased rate has been notified starting the 1st of April 2020. 19.56 lakh persons' man-days of work has already been generated in the current financial year. 7,100 crore rupees have also been released to states to liquidate pending dues of both wages and material. The insurance scheme for health workers in government hospitals and healthcare centers has also been operationalized by New India Assurance, covering 22.12 lakh health workers. Clearly, the government has been working on multiple fronts to ensure that poor are not left out in the cold during the lockdown period. Efforts are constantly on to ensure that weaker sections of society keep getting their basic necessities and proper care. Newsnight Desk, DD India.
So the government is taking several measures to ensure that people do not undergo hardship, particularly the poor sections. But let's go back to the extension of lockdown, in which Prime Minister Modi has reached out to people to appeal to them to follow at least these 7 steps to ensure that the extension of the lockdown is a success. In terms of, if you look at the measures that have been extending relief even after the lockdown extension, Labour and Employment Ministry has said that 20 control rooms have been set up to address wage-related grievances for workers. Further on, if we go on, workers can contact call centres through landline, email and WhatsApp as well. So they can just reach out and convey their grievances. Supervision of these call centres will be done by the Chief Labour Commissioner. So there will be a whole setup, and that will be supervised by the Chief Labour Commissioner. Skill Development and Entrepreneurship Ministry has ensured that 1.75 lakh health sector professionals have been trained under MSDE Skill ecosystem, and this is being enabled in states as well. States have offered facilities for 33 field institutes for setting up quarantine centres or isolation wards. So all these skill development places have been given to states. About 5 lakh masks have been prepared by Jan Shikshan Sansthan. That's another institution as part of the Skill Development and Entrepreneurship Ministry. All establishments have been asked to pay full stipend to apprentices during the lockdown period. That's another step that has been taken by this ministry. Now, what has the railways done? Well, all passenger train services have been cancelled till the 3rd of May 2020. That is something that is definitely there. But full refund for reservation made for cancelled trains will be given. That can be claimed, and that will be going directly to accounts. Full refund also for those cancelling advance bookings for trains which have not been cancelled as of now. You can claim full refund for that as well. Refund for counter bookings can be claimed till the 31st of July this year. Furthermore, operation of all domestic and international airlines has been suspended till the 3rd of May by the Civil Aviation Ministry. That's a step that again has been taken. Now, Chemical and Fertilizer Ministry has said that the NFL is ensuring adequate supply of fertilizers to farmer community. Furthermore, NFL is working at over 100% capacity as well to ensure that farmers get all the fertilizers that they need. 5 plants are producing over 11,000 metric tons of fertilizers on a daily basis. So that's what the Chemical and Fertilizer Ministry is doing, and ensuring that enough is there for farmers. Now, let's look at what the daily briefing had in store for the nation in terms of information from the Health and Family Welfare Ministry. Well, 602 hospitals have been ready to tackle COVID-19 cases in the country so far. 12,024 ICU beds will be there in these hospitals. They're all ready now to combat this outbreak. 1,06,719 isolation beds are also there in these 602 hospitals. 2,13,902 samples have been tested so far in the country, and there's adequate test kits that are available for over 6 weeks now. That's what the Health Ministry is saying. 33 lakh RT-PCR kits are available that confirm, cases of COVID-19. 37 lakh rapid antibody test kits that can also be used to get quick results of COVID-19 tests to become available very soon. 18,644 samples have been tested in government labs today itself, and 2,991 samples have been tested in private sector labs as well. So everybody is working together to ensure that testing is ramped up. Number of ICMR labs has gone up to 166, and apart from that, 70 private sector labs have also been augmenting the government's efforts where testing of samples is concerned. Now, this is what we have in terms of the measures that have been taken. We also now bring you a special report on dedicated COVID-19 hospital that is coming up in AIIMS, New Delhi. Such dedicated COVID-19 hospitals across the country will be proving to be a game changer in the battle against COVID-19.
On the fight against COVID-19, the central government has said that dedicated COVID hospitals is the need of the hour. Right in the beginning, the centre asked different agencies to ensure that dedicated COVID hospitals are functional at the earliest. One such dedicated COVID-19 hospital is ready in National Capital Delhi in AIIMS. It is in a trauma center and burn plastic surgery block.
वहाँ पे बेड जो हैं हमारे यहाँ पे 250 बेड के करीब हो जाएंगे और बर्न्स एंड प्लास्टिक सर्जरी सेंटर में ऊपर आईसीयू भी हम तैयार कर रहे हैं। आईसीयू में 30 बेड और हम ऐड कर पाएंगे जो वेंटिलेटरी पेशेंट के लिए, और एक वार्ड भी वहाँ पे हम तैयार कर रहे हैं जो पेशेंट को हम देख पाएंगे।
This 270-bedded COVID hospital has over 150 intensive care unit beds.
ये यूनिक चैलेंज है, हमें अपने आप को सेफ भी रखना है और दूसरों की लाइफ सेव करना है। मैं तो कहता हूँ कि सारे हेल्थ केयर वर्कर्स और जो हेल्थ केयर वर्कर्स नहीं हैं उनकी भी इक्वल रोल है, तो ये एक टीम कॉन्सेप्ट है।
In view of the sensitivity of corona infection, this dedicated hospital has been divided into several parts.
जब वो पेशेंट पहली बार हमारे बर्न सेंटर को एक्सेस करता है तो वो सारे लोग पहले एक होल्डिंग एरिया में जाते हैं जिसको हमने वेटिंग एरिया किया है। कोई भी ऐसा व्यक्ति जो खांसी कर रहा हो उसको मास्क प्रोवाइड की जाएगी और उनको वहाँ पे सोशल डिस्टेंसिंग मेंटेन करके उस हॉल में पहले हम रखेंगे। जो हमने डिवाइड किया हुआ है दो भाग में है, 2 पार्ट में है। एक है आप देख रहे होंगे ट्राइज स्टेप 1 है, जहाँ पे जो भी मरीज इस ट्राइज स्टेप 1 पे जो मरीज आएंगे यहाँ पे, तो हम उनकी हिस्ट्री और टेम्परेचर और साथ में सैचुरेशन ये सारे जांच करने के बाद देखेंगे क्या इनको सही में अस्पताल में रह के कोई इलाज करने की ज़रूरत है या और कोई जांच करके डिसाइड करने की ज़रूरत है। इसके बाद जो वो सारे लोग जिन्हें हमें लगती है कि नहीं और फर्दर जांच करने की आवश्यकता है, वो हमारे ट्राइज स्टेप 2 आप देखेंगे कि इस कॉर्नर में हमने ट्राइज स्टेप 2 रखा हुआ है। यहाँ पे हमारे डॉक्टर, नर्स, पैरामेडिक रहेंगे। यहाँ पे क्लिनिकल एग्जामिनेशन के अलावे जो इस जगह पे क्लिनिकल एग्जामिनेशन तो होगा ही होगा, उनके वाइटल पैरामीटर्स लिए जाएंगे। ये पूरी व्यवस्था ट्राइज की यहाँ पे हमने इस तरीके से की है कि ओपन एयर हो, अगर किसी को कफ होता है तो इन्फेक्शन के चांसेस और कम हों। वो सारे मरीज जो ट्राइज 2 पे ऐसा हमें लगता है कि जिनको ऑक्सीजन की ज़रूरत है या कोई मेडिकल इलाज की ज़रूरत है या दवाओं की ज़रूरत है, वो सारे इस एरिया में आएंगे जो हम एग्जामिनेशन एंड ऑब्जर्वेशन एरिया या येलो एरिया कहते हैं।
After yellow zone, serious patients will be sent to the red zone, where ICU and other facilities are available.
ये बिल्डिंग जिसमें हम खड़े हैं ये 124 बेडेड हॉस्पिटल है जो कि बर्न्स प्लास्टिक सर्जरी ब्लॉक के तरह प्रोजेक्ट मोड में बनाया जा रहा था। अगर आमतौर पे देखते हो इसे कम से कम 9 महीने लगते काम करने में, लेकिन हमने इसको रिकॉर्ड टाइम में 15 दिन के अंदर, जिसके अंदर 30 आईसीयू बेड है, स्टेट ऑफ द आर्ट फैसिलिटी है। और इसकी खास बात यह है कि जो इसके आईसीयूज़ हैं सारे इन्फेक्शियस डिजीज़ को मद्देनज़र रखते हुए सबसे बेहतरीन आईसीयू सेटअप्स में से है।
In the battle against corona, the safety of medical staff is extremely important, and this COVID hospital has full-fledged safety protocol in place.
जो हम राउंड लेते हैं, हम अपना क्लिनिकल राउंड लेते हैं, वो हम अपना आईपैड या आईफोन पे ले लेते हैं, तो अंदर जाने की ज़रूरत नहीं पड़ती है। पेशेंट को देख लेते हैं, अंदर मॉनिटर देख लेते हैं, वेंटिलेटर की सेटिंग्स देख लेते हैं और सारी इंस्ट्रक्शंस ऐसे दे देते हैं। क्लिनिकल टीम का एक्सपोजर कम होता है, पीपी बच जाते हैं और बहुत सी रिसोर्सेज हमारी बच जाती हैं।
Be it a policy decision or ensuring good medical facilities, the Union government is continuously ensuring necessary steps in the battle against COVID-19.
Well, that brings up our In Focus tonight, and that's PM's 7 steps during extended lockdown. And to talk about it in our studio tonight, we have Dr. A.K. Varshney, Professor, Department of Medicine, RMN Hospital, and joining us on through different medium of video communication, we have Shishir Sinha, Senior Deputy Editor, Hindu Business Line, and also Sanjay Singh joining us. He's Political Editor, firstpost.com. Good evening to you all. First, to you, Dr. Varshney. What do you make of the PM's decision in the first place? Do you feel that this was what was really necessary to ensure that this outbreak that we have worldwide, which India has done very well at combating compared to the rest of the world, we are completely successful and victorious as far as the battle against COVID-19 is concerned?
Yes, you are right. We should learn from the experience of the other world. The China was able to contain the virus infection by completely lock down the Wuhan from where the virus infection started. Unfortunately, the other Western countries or European countries and America, they could not do the lockdown timely, and the infection has spread very rapidly there, and now the cases has gone in lakhs and many thousand deaths. Unfortunately, in our country, it was a timely lockdown, and we were able to contain the virus infection by around 10,000 something and death around less than 300. So, it is a very effective measure, and it is the only measure which can work, because this virus infection spreads by the droplet infection from the infected person to another person, which is in the close vicinity of around 3 to 5 feet. There is no medicine available to treat the infection. There is no vaccine to prevent the infection. Only effective method is the isolation, and isolation can only happen when we do the complete lockdown, so that there is no movement of the person from one place to another place, and every person whosoever is infected, they should isolate themselves, and a healthy person should isolate themselves from the another person, from the infection being spread from one person to another person.
Right. And if I could come to you, Shishir, the PM is very clear this time in the extension, which is also lockdown 2.0, that it will be implemented even more strictly now and very, very closely monitored, because the monitoring will then be consequent for people as well, because if they adhere strictly to the lockdown, there could be some relaxation for certain areas that do not become hotspots and are not likely to become hotspots in the near future as well. There could be some relaxations there as well. So, this is a fairly calibrated response as well, even if there is extension.
You're right, Gautam, and we need to understand that out of 720 districts, almost 50% districts have at least one patient. So we need to think about what will happen in other 50 districts. The other thing is that almost 70% of economic activities are standstill. I mean, there is no activity, and the persons who are affected mostly are the informal sector workers. You must be having an idea about the numbers. I mean, according to International Labour Organization, almost 90% of our labor force are in the informal sector. They do not have any kind of fixed wages or any kind of salary kind of thing. So in that kind of situation, we need to have some kind of economic activities, at least in those areas which are not a hotspot or which are not in the red or orange zone. If they are in the green zone, or if the districts which haven't seen any patient for say last 5 days or last 7 days, there should be some economic activities. So I think this week, starting today until April 20th is very, very critical, and that will also decide that how we will go about the staggered kind of resumptions of economic activities.
Right. Sanjay, just a few days back when the PM spoke to Chief Ministers, he spoke of Jahan Bhi, and that was perhaps misread by a section of the entire society, not just the media, that the PM might be leaning towards some relaxation in the lockdown from this phase itself, from the 14th of April. Well, they've been proven to be wrong, but do you think that this was completely misread, or the PM really thought about it very hard in terms of how to proceed and then decided that the current situation dictates that there needs to be an extension of an even stricter lockdown if that is possible?
I think, Gautam, people in their over-enthusiasm perhaps read some part of it wrong, but not entirely wrong. If you remember, in his first address to nation, this is his third address to nation, and one Mann Ki Baat and one video recorded message. He is directly communicating with people. So in his first message, he had said, Jahan hai to Jahan hai. Last, as you said, Jahan bhi. And today he talked about stricter social distancing measures, lockdown measures. And if you further read into or analyze as to what he said people have suffered in this period, and hats off to them. And we, the people of India, as in collectively, India as a nation, one people. And then he, of course, he underlined that particular part, the part Jahan hai, Jahan bhi, in two aspects. When he says that daily wages and laborers are his family, and he is working very hard to take care of them, and the measures that you, of course, announced some time back in your various capsules as to what welfare measures that government is taking. For two things: A, to give economy a bit of impetus as to where it is moving, and B, as to take care of basic livelihood of people, because Modi had a very difficult choice and a very tough call he had to take as Prime Minister, which several other developed nations did not take and suffered, which was choice between life and livelihood. Now, 3 weeks later, when he announced that lockdown, now he has to take a call as to how much, because in one of the chief ministers' meeting, he had talked about graded exit plan and asking states to come out with that.
Right.
Now, if that graded exit plan has to be implemented, part of it we'll see tomorrow when guidelines are issued, and part of it, he said till 20th, those measures. In fact, by saying so, he is also inculcating a sense of self-discipline among people, and also inculcating a sense of optimism that if you proceed and continue to live in that direction, that is following norms of lockdown and social distancing, then we may, this particular thing may be relaxed, and some part of activity, like the government is already relaxing that for Rabi, harvesting of Rabi crop, which is very, very essential. So I won't say that people got it entirely wrong, but some people in their over enthusiasm thought that this particular thing is going, lockdown is going, which was not possible. Because though we have contained the numbers vis-a-vis rest of the world, but still the cases, the numbers are rising, and PM could not have kind of put in action the graded exit plan as of now. More so because at this moment we are working in sort of cooperative federalism, and several states had demanded, as several other experts, and Modi, of course, had his own ideas. So that
yes, we will have to see what further decisions are taken. Guidelines are to come. We have a cabinet meeting slated for tomorrow as well. But if we talk about the 7 steps, Dr. Varshney, the PM has sought people to follow in the extended period of lockdown. How important are these to ensure that this lockdown is successful? He asks about taking care of the elderly. He says download the Arogya Setu app. He says that we should value our COVID warriors, and they are of course doctors like you, nurses and sanitation workers, as well as police, and these things then become really, really important in our daily lives, really the way they've been altered because of this outbreak.
Definitely, as we see the data from all over the world coming, the most of the persons who have died due to the corona infection has been the elderly person or person with the comorbidities like diabetes, kidney disease, heart disease, HIV, and taking any other immunosuppressive medicine. That means those persons who are having very low immunity. Most of the mortality has been in those groups. So definitely it makes sense to enhance the immunity of the person, and if the person has the good immunity, the chances of catching the infection will be reduced. And to increase the immunity, one should take the good healthy diet, good protein diet like milk, curd, dals, pulses, etc. If any person is non-vegetarian, they can take the eggs and non-veg also, but that should be properly cooked. Then they should do some regular physical exercise, whatever they are doing. Some yoga and meditation also helps in increasing the immunity, and the other things like the vitamin C containing fruits, citrus fruit like amla, nibu, oranges, they also help in increase the immunity. So if your immunity is good, chances of catching the infection is very low. But further, all those persons whose immunity is low, they must isolate themselves absolutely from the infected person to prevent the infection of the disease.
Right. And Shishir, there's a lot of emphasis on also making maximum use of the Arogya Setu app. Crores of people have already downloaded them onto their phones, but it seems that the maximization here is required for this app to do the maximum amount of good for the country as well.
Certainly, because this app is giving a kind of signal, or it is giving kind of indication that whether I'm close to somebody who has been infected or not. So I think downloading this app is very, very important, because at this moment you do not have any sign. I mean, Dr. Varshney can second my statement that almost 80% of people do not have the kind of symptoms which you can see very clearly that he is suffering from COVID-19 or something like that. So only option is whether the technology is available or not, and whether that technology is able to identify that particular person. So with the help of that app, we can maintain the social distance, and thus we can easily take out ourselves from that kind of situation. So I think that app is really, really very helpful, and I would like to appeal to all the viewers that please download that app. That is really going to help you.
And Sanjay, if people had downloaded the Arogya Setu app, perhaps you wouldn't have seen gatherings such as the one that we saw at Bandra station today. That was something that shouldn't have happened at all, considering how important it is to maintain social distancing.
Precisely, Gautam. What happened in Bandra was very, very unfortunate. Given people also understand, and they have so far maintained, barring the incidents of migrants workers leaving their respective places and going to their hometowns in the beginning when lockdown was announced. And then government actually, respective states did actually a good job to move them and put them in quarantine. But today what happened in Mumbai was very unfortunate. I think state government should have been very active, because what I sense, and to my assessment, that is a case of organized humor mongering with intention of creating some kind of mischief. Because this wouldn't have been possible. Bandra is no railway station, no bus terminus from where people could be taken to states in northern India or wherever. So that part, state should have tackled that more firmly. Arogya Setu thing, as you said, maximization of downloading and people actually accessing helps. The third thing that you're talking about, the Ayush guidelines as to how to enhance your immunity. That is very user friendly. I think that's a very healthy thing. Your household has all those things which Ayush ministry prescribes to enhance your immunity. That is for today and also for times to come. As I would also like to mention the thing that you're talking in the program's introductory kind of capsules, whereby we had not anticipated in our country, and that goes to compliment of Prime Minister and to Health Ministry, and also to states and large number of medical personnel, hospital administration, their doctors, their karmacharis, and so on, their support staff. The kind of health infrastructure that we have succeeded in creating in this very short period, in these very challenging times, when we had very limited resources, when less number of people coming in, movement of main material, everything was restricted. Under those
and it's best that all those resources that have been ready to combat this outbreak are not really put to the test, and if people adhere to this lockdown, that's the kind of result that we're trying to get for the country as well. Let's hope that happens, and this extension of the lockdown is completely successful in getting a complete grip over this outbreak, this pandemic of coronavirus. That's all we have time for the moment. Thanks a lot for joining us this evening, Shishir and Sanjay, and of course Dr. Vashni here in our studio.
Thank you.
Okay, moving on to combat, of course, coronavirus, the Defence Research and Development Laboratory, that's DRDL Hyderabad, has added another product to the portfolio of Defence Research and Development Organization by developing COVID sample collection kiosk, that's COVSAC. The unit has been developed by DRDL in consultation with doctors of Employees State Insurance Corporation, Hyderabad. The COVSAC is a kiosk for use by healthcare workers for taking COVID-19 samples from suspected infected patients. Patients under test walk into the kiosk, and a nasal or oral swab is taken by a healthcare professional from outside through the built-in gloves. The kiosk is automatically disinfected without the need of human involvement, making the process free of infection spread. The shielding screen of kiosk cabin protects the healthcare worker from aerosols or droplets transmission while taking the sample. This reduces the requirement of PPE change by healthcare workers. After the patient leaves the kiosk, 4 nozzle sprayers mounted in the kiosk cabin disinfect the empty chamber by spraying disinfectant mist for a period of 70 seconds. It's further flushed with water and UV light disinfection. The system is ready for next use in less than 2 minutes. Voice command can be given through two-way communication system integrated with the COVSAC. It's possible to configure a COVSAC to be used either from inside or outside as required by medical professionals. The COVSAC costs nearly 1 lakh rupees, and the identified industry based in Belgaum, Karnataka can support 10 units per day. The DRDO has designed and developed 2 units and handed over these to ESIC Hospital, Hyderabad after successful testing. Now, in the Union Territory of Ladakh, Kargil district, alert ASHA workers, paramedics and doctors of Kargil Health Department have helped a pregnant woman with safe delivery from COVID-19 containment area. A 38-year-old pregnant woman reported at a primary health center in Chiktan recently with labor pains coupled with certain complications. Moreover, as she was in COVID-19 containment area, the health department had to take extra precautionary measures. Like all the staff in the labor room were provided with personal protection equipment to deal with the delivery process.
एज पर द प्रोटोकॉल्स जितने भी कंटेनमेंट जोन में कैसे डिलीवरी करना है उसके हिसाब से पर्सनल प्रोटेक्टिव इक्विपमेंट्स डाल के इसको भी अच्छी तरह से मास्क वगैरह डाला के मेरी जो बानो है ये भी असिस्ट कर रही थी मेरे साथ। मेरी नाम थी नरगिस बानो, गुलनियार बानो, वो भी मेरे साथ थी। उन्होंने भी प्रोटेक्टिव इक्विपमेंट्स डाले हुए थे। तो हमने अच्छे से पेशेंट को डिलीवर करके और एक फीमेल बेबी डिलीवर्ड हुई 3 kg की लगभग इसका वजन था और 6:30 बजे के करीब इसको अंदर लिया था और 7:30 तक इनकी डिलीवरी हमने अच्छे से कर दिया।
And Jammu and Kashmir Union Territory Lieutenant Governor Girish Chandra Murmu held a video conference on Tuesday to interact with doctors and sought their valuable suggestions for better management and containment of COVID-19 pandemic in the Union Territory. Deliberations were also held on various important aspects including procurement of protective gear, increasing testing capacity, awareness on COVID-19 by medical experts among others. Advisor to Lieutenant Governor, Chief Secretary, doctors and medical experts participated in the deliberations. Now, over 1,000 migrant workers who earn daily wages gathered in Bandra in Mumbai, demanding transport arrangements to go back to their native places hours after Prime Minister Modi announced the extension of the coronavirus enforced lockdown by till the 3rd of May. The migrants were dispersed 2 hours later and have been assured accommodation and food till the lockdown lasts. Meanwhile, Union Home Minister Amit Shah called Maharashtra Chief Minister Uddhav Thackeray and expressed concern over the Bandra gathering. The Home Minister stressed that such events weaken India's fight against coronavirus and the administration needs to stay vigilant to avoid such incidents. He also offered his full support to the Maharashtra government.
बांद्रा रेलवे स्टेशन के परिसर में कुछ 1500 के आसपास लोग जमा हुए थे। उनमें से काफ़ी संख्या में पर प्रांतीय मजदूर थे। उनका लॉकडाउन एक्सटेंड होने की वजह से मन में एक असंतोष था और उन्हें घर वापस जाने की एक आतुरता थी। स्थानिक डीसीपी, एडिशनल सीपी वहां जाके उन्होंने उन्हें कन्विंस करने की कोशिश की, उनके साथ चर्चा की। इस चर्चा के दरमियान क्राउड का कुछ भाग अग्रेसिव हो गया, जिसे कंट्रोल में लाने के लिए सौम्य बल का प्रयोग करना पड़ा और उस भीड़ को, उस गर्दी को वहां से डिस्पर्स कर दिया गया।
Now, the BJP has slammed the state government over the incident in Bandra.
बांद्रा में हुई घटना बहुत ही गंभीर है। हम पहले दिन से सरकार को बता रहे हैं, जो माइग्रेटरी लेबर है, जिनके पास रेशन कार्ड नहीं है, इनकी व्यवस्था सरकार को करनी होगी। किंतु दुर्दैव से सरकार ये व्यवस्था करने में असफल रही है। अपनी असफलता को छिपाने के लिए एक और लोगों को मदद करने की जगह सरकार के मंत्री अगर ये कहते हैं कि इसके लिए केंद्र सरकार जिम्मेदार है, तो ऐसे समय भी राजनीति करना ये कितनी गलत और शर्मनाक बात है। मैं तो सरकार से निवेदन करना चाहता हूं कि सबसे पहले इन लोगों की सुध ले और ऐसे लोगों को कैसे भोजन मिलेगा, ऐसे लोगों को कैसे रेशन मिलेगा, इसकी जिम्मेदारी सरकार ने लेनी चाहिए।
The Revenue Department has launched electronic delivery of gate passes and final bills of entry to customs brokers and importers with an aim to further simplify import clearance process by reducing human interface and to help tackle the scourge of COVID-19. The CB, Central Board of Indirect Taxes and Customs, said the measures will be effective from Wednesday. The CBIC said that it has taken a number of measures to facilitate and expedite customs clearance process, making it more and more contactless in order to mitigate the unprecedented situation due to COVID-19 pandemic. These measures include the facility to clear goods on the basis of an undertaking and acceptance of electronic country of origin certificate. The e-gate pass copy will be used by the gate officer or the custodian to allow physical exit of the imported goods from the customs area. Now, in a major relief for thousands of stranded Indian professionals in America due to the coronavirus pandemic, the U.S. government has decided to accept their H-1B visa applications for an extended stay in the country. The H-1B visa is a non-immigrant visa that allows U.S. companies to employ foreign workers in specialty occupations that require theoretical or technical expertise. The U.S. Department of Homeland Security, in a new notification, has said it recognizes that there are immigration-related challenges as a direct result of the coronavirus pandemic. The announcement comes at a time when countries around the world have closed their borders and all international passenger flights have been suspended globally. The travel restrictions have left a number of H-1B visa holders stranded in the U.S. with their visa permits soon to expire. However, the DHS will shortly start accepting applications for the extension of expiring visas. Moving further on, if we look at what is happening in other parts of the world, well, the PIB has in fact been talking about fact checks as well, but we'll tell you a little bit more about it a little later. Let's tell you what is happening in terms of what's happening worldwide in terms of the coronavirus outbreak. Well, the French government has scrapped its days-old economic outlook after President Emmanuel Macron extended a national lockdown, shutting down swaths of the Eurozone's second biggest economy. The French finance minister said the economy was now expected to contract 8% this year instead of 6%, revising the number to take the longer lockdown into account. Spain's overnight death toll from the coronavirus pandemic has risen to 567 on Tuesday from 517 a day earlier, while the country reported its lowest increase in new cases since the 18th of March. Tuesday also marked 1 month since Spaniards have been kept under lockdown. Meanwhile, back home, Prime Minister Narendra Modi spoke on the phone to Mahmoud Abbas, President of the State of Palestine. Prime Minister Modi conveyed greetings to the President and the people of Palestine for the forthcoming holy month of Ramzan. The two leaders discussed the challenges posed by the ongoing COVID-19 pandemic and apprised each other of the steps being taken in their respective countries to control the situation. The two leaders agreed to remain in touch at appropriate levels to explore avenues of cooperation at this challenging time. Now, a lot of fake news is all over social media. One such claim is that money transferred to accounts under PM Garib Kalyan Yojana will be taken back if not withdrawn. The Press Information Bureau of the Government of India has called it a rumour and clarified that money will not be taken back from the accounts. Another claim is that in the middle of these difficult circumstances, the Prime Minister is helping every Indian with 15,000 rupees, and to get that one needs to click on a link and fill the form. The claim is absolutely false and the link is a fraud. You're well advised to refrain from rumours or fake news. And the nation remembered one of the founding fathers of its constitution on his 129th birth anniversary on Tuesday. President Ramnath Kovind offered floral tributes at Rashtrapati Bhavan. Vice President M. Venkaiah Naidu also offered floral tributes. Prime Minister Modi remembered Dr. Ambedkar on his birth anniversary and shared a video as well. Lok Sabha Speaker Om Birla paid his tributes. Union Home Minister Amit Shah also offered floral tributes to Baba Saheb Ambedkar at his residence in New Delhi. In view of the coronavirus pandemic, BJP workers distributed ration and masks among the poor on the occasion of Baba Saheb Bhimrao Ambedkar's birth anniversary. BJP President JP Nadda, while addressing party workers, also appealed to them to engage in social work, follow social distancing norms. JP Nadda said that Baba Saheb Ambedkar has always been a source of inspiration for BJP workers, and the Modi government has been working to further propagate the thoughts of Baba Ambedkar. With that, we've come to an end of Newsnight, and do stay tuned to DD News and DD India for all the latest as far as the updates on the outbreak of coronavirus is concerned. Stay home, stay safe. Good night.